here, again, you get to pick. So do you see where it says Biphasic in Russian? So the first button, Biphasic, will light up, and that's what I want, okay? So do you see it's a 10-minute automatic default setting, so you can leave that. So your first option is a type of contraction, normal, co-contraction, or reciprocal. So in other words, you want two opposing muscles, which is co-contraction at the same time. Do you want them to alternate between muscles? We just want normal. We just want the biceps to work right now. Your other options are the duty cycle. So do you see it has a 10-10, which means 10 seconds on, 10 seconds off, 10-30, 10 seconds on, 30 seconds off, and 10-50, 10 seconds on, 50 seconds off. There's also a continuous and a custom setting, so we're just going to be concerned about 10-10, 10-30, and 10-50. So if you're using this to get increased strength, and someone's weak, we usually start with 10-50, so it's a longer relaxation time, because if someone, for instance, has a weak quad, if you don't give enough relaxation, if you overstimulate them, they're going to get up and their quad's going to give out and they're going to fall, and if they get hurt, you're going to be in trouble for it. So we're going to start with 10-50. For a demo, I'll probably do a 10-30, so we don't have to look at them for a whole minute almost. Do you see why this is a default setting of 10 minutes? Because they're assuming if you start with a 10-50, that's a total of 1 minute, so you're going to get 10 contractions. Okay? 10-10, we're going to use that to fatigue out a muscle, so we're going to use that for the low back if someone has muscle spasm to fatigue it out. But why don't we say we need to build up her biceps, so I would start at 10-50, but for demo we're going to do 10-30, okay? And here's the ramp time that I talked about in class. So ramp time is all about what? For the patient, how much, like how quickly it ramps up and how quickly it ramps down. So it's all about what for the patient to make it more comfortable. So it does start at 0.5, that's what I thought, and goes all the way to 2 seconds. So we are going to go all the way there. Longer ramp times, more comfort for the patient. Good? Okay, so let's look at Alyssa. So Alyssa, we're going to do something called biphasic muscle stimulation to your right biceps to increase strength, right? It would increase circulation. Maybe if we increase strength, maybe it'll help with range of motion, definitely going to help with function. Contraindications, do you have any history of unstable cardiac arrhythmias like abnormal heartbeats? History of seizures? Pacemaker? Okay, there's a whole other list of them. All right, so I would still do a skin check. All right, so can you feel me touching you? I'm gonna use this one.
Yep.
All right, so again, I'm making sure she can feel me, because if she can't feel me, then she can't tell me if it's gonna be too strong, and to make sure there's no open wounds. Feature your pads.
Yep, right down there.
All right, so this is why you need to know your kidneys, because you need to know where these muscles are to stimulate them. So this is what current? What kind of current? You have a choice of two. It's AC current, and it's going to be pulsatile because it's going to be more comfortable. And the pads have to be at least what if it's AC current? How far apart?
3 to 4 inches. No, it's 1 inch.
1 inch, because it's AC. Direct current, yeah, is 3 to 4. All right. So can you try touching your hand to your shoulder? So you want to find the muscle belly as best as you can, right? Because the muscle belly is going to be better, has more water than the tendon. Pull up.
Now with the biceps, are you looking for? Are you trying to distinguish both heads, or it doesn't matter?
Just the muscle belly. I usually want the muscle belly, not really where the origin and insertion are. And if it's not right, it's going to tell me it's not right when I go to contract it. So do you see where this will be against gravity, the position I have her in?
Yes.
Right? And if that was a problem, what I use is that I bring that table over sometimes, and I'll do gravity eliminated position. This way, this is how I'll do her triceps actually in that position, or whoever's triceps. But usually biceps we can get this way. And again, I know it's one channel because only one channel is lit up. And I just want one of these, doesn't matter what color it is, just so they're both the same length. And again, no wires showing, right? So Alyssa, what I'm gonna do is when increase the intensity here, you're gonna let me know first, you're gonna feel a tingling sensation. What happens is gonna get stronger and stronger till we actually see the muscle contract or pull a little bit, and then, you know, we can get it literally as strong as it will do the whole motion for you. But, you know, it has to be within your comfort range. So again, usually when you first start to do this and someone's really weak, you need more power by the machine. As they get stronger, less power on the machine, more on them. But the goal is you have to get some, at least a muscle contraction. If you can't increase the intensity so you can get a muscle contraction, then why are you doing this in the first place? Does that make sense to everyone? So you at least have to get the contraction. It's up to her if she wants to tolerate any more. Okay? All right, so that's it.
Make the bicep dance.
Yeah. All right, and again, I don't prolong the agony, so I just keep going, and you're gonna let me know what you feel, okay?
I just start to feel it.
Okay.
That's it. Just supinate.
If it's too much, you let me know.
I can feel it contracting a little bit.
I can see it, and I'm just gonna go until you tell me to stop.
And what do you want me to feel in the end? Just a comfortable.
Contraction, I mean, it's powerful, it'll
Yeah.
move the whole arm up.
That's comfortable.
Okay, so start. All right, so what it's gonna do is as you feel it, pull it up, pull, 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 hold, hold, hold. It's gonna be on for 10 seconds. Hold, 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 hold. When you feel the machine shut off, you slowly lower to get the eccentric contraction of the biceps. And relax, so it's gonna relax. I have it for 30 seconds, should be 50, but we did 30. And that's what you do through a set of like 10. And you have to see, maybe a patient can only do 5, assist with 5, but 10 is kind of a ballpark, but it's not like you're gonna start with 50 or 60 the first time, because you don't wanna over fatigue it either. All right, so that was an okay as far as
Yeah.
tolerating that? And as soon as you feel it again, you use your voice as like a stimulation. Okay, pull, 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 pull. All right, keep going, go, go, keep going, 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 hold, 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 hold. Keep holding, keep holding. When you feel it shut off, just lower it slowly, and you have to know that you're doing eccentric of the biceps here. All right? So I'm not gonna keep having you do it, but it's that easy. It's just the placement. When you're done, huh?
Never seen the bicep done.
Yeah, so when you're done, you just make sure you're careful with the pads, right? Just don't rip them. So you rip her skin. And then you would do the skin check at the end. Can you feel me touching you? They're usually a little bit pink, and that's normal because it increased circulation. Usually with this stuff, in 30 to 60 minutes, if you get any pinkness, it should go away. That's normal. 30 to 60, that's actually in your PowerPoint, I believe. So, all right, who wants to do triceps?